Good morning. Thank you so much for joining us today. For more than 18 months, healthcare workers have been on the front lines, battling COVID-19 and saving lives daily. As the St. Louis region continues to struggle to increase our vaccination numbers and reduce the spread of COVID-19, I'm so proud to announce that Dr. Mati Shlashwayo Davis as the new Director of Health for the City of St. Louis. Dr. Shlashwayo Davis's demonstrated leadership and decades of experience will play a critical role in leading our city out of the pandemic. She's a national leader, an expert on infectious disease, and has dedicated her life to medicine and battling the HIV epidemic. She received her medical degree from Cleveland Clinic, Lerner College of Medicine, and her master's in public health from Case Western Reserve. Dr. Shlashwayo Davis is an outspoken advocate pushing to address the structural racism and disparities within the healthcare administration system. The role of Director of Health is a crucial and critical component in moving St. Louis forward, from increasing the life expectancies of our most vulnerable communities to managing administrative healthcare systems. This position contributes to the future of our city in both tangible and intangible ways. I am confident that Dr. Shlashwayo Davis is capable of leading that charge. I also want to take this opportunity to thank our dedicated public servants in the Department of Health for all their essential health and all of our essential healthcare workers who have tirelessly worked around the clock during this pandemic to protect our residents. Words cannot express my deep gratitude and appreciation. Thank you to Dr. Eccles, who has provided leadership and expertise to our city. We are glad to have him continue in his role as Commissioner of Health. Now, it's my great pleasure to give the floor and the podium to Dr. Shlashwayo Davis for her remarks. Yes, give her.
Honorable Mayor Tashara Jones, members of the press, I am humbled and honored to accept this position, which affords me the opportunity to continue to serve the city that I love, now at the highest level. In this city, I have cared for patients in 2 different hospital systems. I have taught and led initiatives in our communities. And with my husband, Jesse, I have raised my own children alongside the residents of this great city. I am thankful for the opportunity provided me at such an important time in our nation to step up and to serve as the Director of Health as we face perhaps the most challenging part of this pandemic. We are tired. Many of us have lost faith, lost loved ones, but we must persevere. My commitment to medicine and to public health is rooted in the loss of my father, a veteran himself, from my home country who succumbed to the complications of cancer and diabetes. Preventing similar outcomes, providing care to people at their most vulnerable, and advocating for our community has been my primary focus. My experience as an infectious diseases physician, my training in public health, and my passion for community engagement provide me with the tools needed to serve you at this critical time. I have seen firsthand what COVID is doing to our loved ones. I have counseled my own patients on the risks and benefits of a vaccine, and I understand what we need to do as a society to reach our new normal. What I ask of you will not always be easy, but I can assure you it will be backed by science and seen through the compassionate lens of a fellow human, a woman, a mother, a daughter, a wife, who has had to make the same impossible decisions, trying to secure the future of my daughters and this community. In the coming weeks, I will review the current processes, initiatives, and policies that has seen us through thus far. I will be meeting with the leadership and staff who have worked tirelessly to keep us safe and prioritize our well-being. I will also meet with community leaders, academic partners, and residents. I will listen. Together, we will map a path forward that centers the health of everyone with equity, addresses gun violence, prioritizes mental health, and gives St. Louis the foundation to provide all our communities the opportunity to achieve the very best quality of health. Thank you all.
I think more importantly, it was important to find someone who was willing to take on all of the challenges of our public health system right now. It's not just about infectious disease, although COVID is a real and present danger. It's also about gun violence. It's also about making sure that our health department returns to the stature that it once had. And I think that Dr. Slashwayo Davis exhibits all of those qualities and will help us do that. Well, we don't do a very good job at funding our public health department or our public health services in the city of St. Louis. And also, we are tops in the nation for gun violence as well as sexually transmitted diseases. I also have a background in health administration, so I made sure that we vetted this position very, very carefully. But wanted to have someone who shared my ideals and my morals in leading our public health system again to make sure that we are addressing all of our issues, not just one that's present right now.
Congratulations to you, Dr. Davis, and welcome. You spoke on gun violence, and I did just have to ask you, could you speak to the shootings that have been happening near the Rain nightclub and around the Enterprise Center, and if you agree that those should still be in business, like have a liquor license?
Well, one shooting is one too many. And I am the first mayor in over 20 years to be born, raised, and still live in North St. Louis. So there aren't too many evenings that I don't go to bed to the lullaby, when my son and I don't go to bed to the lullaby, gunshots in the distance. So this isn't just about downtown. This is about addressing gun violence citywide and making sure everyone lives in safe neighborhoods and doesn't fear for their children playing outside like I do, or simple walks to the store or handling business in their neighborhoods.
Mayor, I have a question. Did Dr. Eccles apply for the health director position under you, or?
He did. Yes, there was an interview process, yes.
Did you consider him, or was he ruled out because of the city concerts?
He applied for the position, and we chose Dr. Slashwayo Davis.
Yeah, I think the city's challenge mirrors what we are facing nationally right now, in that in combination with this extremely challenging Delta variant, and at what I would consider some of the lowest levels of vaccine confidence in folks who are still on the fence or choosing not to be vaccinated, We're about to enter a winter season. And so the priority for me is to try to continue to push for people to consider vaccines as their best available tool in the toolbox that we have provided them to protect not only themselves, but their loved ones and their community. Access is an issue, though. For me, the work that I've done has been predominantly in marginalized communities. And we know that since last year, vaccine confidence has actually gone up significantly in those communities, and yet they are still the most unvaccinated, which tells us that access is an issue. So what I'd like to do is strengthen the efforts of the health department, who have done a superb job, let's be clear, but also bring innovation and strategy to get us across that line. We are seeing increases in rates, hospitalizations, and deaths across the cities. We have seen numbers increase in our children. That is not acceptable. And so that will be where I spend the bulk of my focus as we continue to address this pandemic. So as you've seen, we have extended the masking mandate, and my priority is always to be backed by science and to be data-driven. So we will continue to look at case positivity rates, the guidance of the CDC, and other trusted messengers in making those decisions as they go. However, I want to be clear, I will always prioritize the health and safety of our citizens, particularly at a time where we have our children back in schools. We must always be thinking about the best methods available to keep them and our teachers protected. Hi. Good to see you again, Mark.
Just a question. How long have you chaired and co-chair of that AIDS, HIV collaborative?
So Mark is referring to my position as the co-chair, now outgoing co-chair, of the Fast Track Cities Initiative, which brings the county, the city, the mayor's office, and many of the major HIV community groups together to end the HIV epidemic. I have been co-chair for just under 2 years now. Thank you, everybody.